Please subscribe and don't forget to press the bell icon to get notified whenever we upload a new video.
Well, the NITI Aayog, in association with the World Bank, has put out an index rating states on various health parameters. Kerala tops the rankings. It is the #1 state when it comes to the state-wise health index. To explain to us how this survey has been conducted and what will happen now with the readings that have come in from this index. Joining us is the CEO of the NITI Aayog from the NITI Aayog headquarters, Amitabh Kant. Mr. Kant, thanks very much for joining us. Let me first, before we get into the nitty-gritties, ask you, what does this survey tell us, what does this index tell us about the state of India's health today?
Shireen, first of all, there's a huge amount of work to be done on primary health care. There is a need to bring in good governance practices. Too many vacancies at district hospital level. Too much of work to be done at primary health care level. And what it really shows is that there is a need to lay all our attention, all our focus and all our energy on primary health care. And this is strictly the responsibility of the state governments.
So the primary healthcare system is well and truly broken.
It is. There's no doubt.
States.
There's no doubt about it, and that's why in this budget, one of the key announcement is that government needs to set up 1.5 lakh health and wellness centers. You need to improve on infant mortality. We need to improve on maternal mortality. But more important than that is that 8 crore people in India go down below the poverty line every year simply because the out-of-pocket expenses are very, very high. So we need to and this is happening because we've not been able to structure a great primary healthcare scheme in some states, and we need to improve on that.
Okay, so let's talk about specifics now. And as I pointed out, Kerala on the top as far as the rankings are concerned, followed by Punjab, Tamil Nadu, Gujarat, Himachal Pradesh. The East, Mizoram, Manipur, Meghalaya, Sikkim, the top performing small states, a lot of the eastern states making it to the rankings there. In terms of the worst performers, Madhya Pradesh, Odisha, Bihar, Rajasthan, UP, are you seeing any change, any improvement, even in the states that have traditionally been laggard states when it comes to healthcare, education, any other kind of social indicators?
So, Shireen, first and foremost, this is the first index of its kind in the world, which has ranked states on health performance. And and we've done two kinds of rankings. What you are talking about is a historical ranking. Historically, how do states perform? How have they performed? Now, states like Kerala, Tamil Nadu, Punjab have historically invested a lot in good practices on the health side. But we've also done a second ranking, and that is incremental ranking. It's very important, according to me, to create a base level of where the states are right now and how they are improving over a period of 1 year.
So who has improved over the year?
Capture that delta, capture that change. And that is important. It's very unfair to compare Kerala with, say, Bihar. But what we must compare is how they are performing over a period of 1 year. And if you do that incremental ranking, the most improved states, you find Jharkhand has done very well. You find Jammu and Kashmir has done very well. You find Punjab has done very well. And Uttar Pradesh has done very well. So Jharkhand, Uttar Pradesh and Jammu and Kashmir are the most improved states if you look at the delta, the change during the course of the year. And among smaller states, Mizoram is the most improved states. And amongst union territories, Lakshadweep is the most improved state. And now, having created that base level, every year we'll come out with this delta ranking of how change is taken.
The incremental change
how the change is taken.
But let me ask you this now, what does this index mean from a policy perspective? The last conversation that you and I had, you said that we will name and shame states that don't perform when it comes to health. This in a way is your attempt at doing that. So what is it now going to mean in terms of policy prescription?
This is about naming and shaming. This is about saying that which states, we've also given tables here to show as to which states are coming down and which states are going up in different parameters. So for state health administrators, it's very easy to find out where they need to improve. But important thing is, as you said, that eventually performance must be directly correlated to funding. And one of the good things, this report is jointly done with the Health Ministry and the World Bank. And what the Health Ministry said is that, right now they have 10% of the total pool of money under the National Health Mission, which they give as incentive. They will take it up to 20%. And those which are the best performing states will get additional allocation. What we are trying to do is to correlate good performance, incremental good performance, with increased outlays. And that, I think, is a paradigm shift in India.
I want to now talk about specific issues. Let's take a look at the sex ratio, number of girls per thousand. Best, Kerala at 967, followed by Chhattisgarh at 961, West Bengal at 951. The worst, Haryana 831, Uttarakhand 844, Gujarat 854. So in terms of specifics, when it comes to infant mortality, when it comes to improving the sex ratio, what is the remedy? What is the answer now? And how is the NITI perhaps going to work with state governments to be able to design policies?
Two things. What comes out as a lesson out of the study is that there are huge variations amongst Indian states. And there is a huge need to work in partnership with the states. So what we did simultaneously, while we challenged the states in terms of performance, we also worked with them. We did series of workshops. We did about close to 7-8 workshops for every region, so that states could see what's happening in the neighboring states. The northern states must learn what is happening in the southern states. Why is Kerala and Tamil Nadu done well? The eastern part of India must know that. So there was a huge learning of experience.
Is it linked to budgetary allocation? I mean, and historically, as we've just discussed, Kerala has been an outperformer when it comes to social indicators, specifically health, education, etc. But what are some of these states where things are working, getting right?
Well, one is, first and foremost, there's a huge political and administrative commitment towards health. That's number one. Secondly, in their states, the primary healthcare is working beautifully. There are no vacancies of doctors. Doctors are not regularly transferred out. There's a huge care system at ground level, at zero level. I mean, that is broken down in certain other states. And that, actually states like Jharkhand and Chhattisgarh have now hired doctors. So this study needs to be studied, needs to be read in the context of several other changes which the government is bringing in, because there's a huge shortage of doctors. And we are trying to, restructure the institutional mechanism of the Medical Council of India.
Where does the fate of the bill lie, sir?
It's with the Parliament.
I know it's with Parliament, but it was expected to be taken up in the budget session. It's gone before the committee, the parliamentary committee. So let them have a look. They had earlier made a very strong recommendation of the structural changes required. So I think that institutional reform will ensure that there's a larger flow of doctors available to the country. I mean, imagine what would have been the fate of this country if we had shortage of engineers. But today, engineers, you have almost 60 times more engineers than you have doctors. You've allowed free flow of engineers. We should have done the same with doctors. And once you have more doctors at the grassroots level, ensure excess supply of doctors, and that's important. But what is the role of the primary healthcare and private sector, sir? I mean, this is a recommendation that the NITI Aayog has made in the past. It's generated a fair amount of controversy. But what is the role? For instance, there are these hybrid models the states of Rajasthan, etc., have experimented with. In primary healthcare, is there a role for the private sector?
So I'm a great believer, Shireen, that the primary healthcare is the responsibility of the government. I strongly believe that primary healthcare is where the government must step in with all its resources. That's its basic duty towards its citizens. The primary healthcare is truly the responsibility of taking care of its citizens. Secondary level is where the private sector steps in, and secondary level care. And to my mind, if we are able to take good care at the primary healthcare level, you will not have so much of an acute problem at the tertiary care level, where so many people are going below the poverty line. But at the tertiary care level, we should have different models of private-public partnership, but we should have these models in a transparent, competitive way. And what we feel is that the model that NITI Aayog is saying is that we've allowed free flow and free play of private sector in the tertiary care sector. Whereas in several of these areas, you need competition to come in. You need markets to be built. Let the market take care of it.
Is the idea then through the insurance scheme that has been announced in the budget to really get whether it's the medical profession or the insurance sector, is that the government's way of, in a sense, regulating these sectors?
So it's, first of all, it's not an insurance scheme, it's an assurance scheme. You know, I mean, it's important to make a distinction between...
it was announced as an insurance
well,
scheme.
it's almost like an assurance where the government says that we will provide you benefit up to 5 lakh rupees for 10 crore families and 50 crore individuals, which works out to about roughly 50 crore citizens. So up to 5 lakh means that citizens will have now there are different models available. I mean, the 24 states in India, we've looked at experience across countries, where what kind of schemes have done well. We've studied all that Indian states have done. 24 states have done it, and out of these, the best performing one is the one in Rajasthan, where they provide assistance up to 3.5 lakhs, and they support them. You know, the premium is about roughly 500 rupees, but it's directly linked to Aadhaar of the family, and it's a very well structured, very thought through scheme. So I think we've learned, we've done a lot of learning out of international good practices and domestic practices, and we'll take them forward as we go along.
Is this index going to be used in any form or fashion while you try and develop the partnership model that you intend to take forward?
But this is more to tell the states how they perform. This is more to make good governance as good politics. This is about what Prime Minister has talked about repeatedly. This is about cooperative and competitive federalism. I mean, my own experience from ease of doing business really showed that first year Gujarat came number 1, but the very next year Telangana and Andhra did beat Gujarat, and Jharkhand and Chhattisgarh did very well. So my expectation is that once we put this in public domain, we will see a huge amount of competition in states, and I will not be surprised if next year Jharkhand, Chhattisgarh, Bihar all take on the challenge of beating Kerala and Tamil Nadu. That's number 1. Number 2, what we are doing next year is to work in very close partnership with the states which have not done well, so as to ensure that they catch up with the rest of India. So NITI Aayog will do a series of hand-holding, it will act as a catalyst. And thirdly, I think very important, and this is the key, rank all our district hospitals. So we'll be ranking close to about the health of our hospitals is our next ranking. We'll be ranking 730 hospitals, and that will bring out which states, how many hospitals are not performing well, and what we need to do to restructure
This is government, obviously.
This is
government hospitals.
Government hospitals across states.